South Korea is set to shift its categorization of COVID-19 to endemic level, more than 4 years since the outbreak of the disease. Starting May 1st, the government will lower its crisis level to the lowest of its 4-tier system, and accordingly, some of the remaining mandatory safety measures will be lifted. Bo-kyoung has the details.
From alert to the lowest level of attention. Starting May 1st, South Korea will fully shift its COVID-19 status to endemic, lowering the disease in its 4-level crisis system from the second highest to the lowest. This decision comes more than 4 years after the first COVID-19 infection was identified on January 20th, 2020. The health authorities cited the country's stable situation with a low fatality rate, and none of the particularly dangerous variants being detected as the reasons behind the decision.
COVID-19 is safely being managed. After we listened to experts' advice twice, last January and April, most of them agreed on the possibility of lowering the crisis level.
According to the Korea Disease Control and Prevention Agency, the number of new COVID-19 patients in the second week of April was 22,083, a sharp drop from the 47,005 reported in the first week of March. Another reason behind the decision was that no other new variant, except for the JN.1, which made up more than 83% of new cases, has been detected. As South Korea fully shifts to an endemic approach, some of the remaining mandatory safety measures will no longer be applied. The mandatory indoor mask requirement that remained for hospitals and other infection-vulnerable facilities will be lifted, as will be the preemptive COVID-19 tests that were required for people entering such facilities. Quarantining for 24 hours is still recommended for patients after their main symptoms dissipate. Additionally, government coverage of associated medical costs will end, no longer paying for COVID-19 tests or the hospitalization of severely ill patients. Patients will also have to partly pay for Paxlovid, an oral antiviral pill, except for those in low-income groups. COVID-19 vaccine will be freely given to everyone through the 2024 flu season, but afterward, coverage will be limited to high-risk groups, including people aged 65 and over, and those with compromised immune systems. Lastly, government-level response organizations such as the Central Disaster and Safety Countermeasures Headquarters, which has been overseeing COVID-19-related measures since its outbreak, will be disbanded. Bo-kyoung, Arirang News.